All right, so here's another coordinated tumor attack on against cancers, cancer metastasis, or an effective strategy to prevent cancer. So the first step is a vitamin C, because vitamin C keeps zinc in a more available state. So vitamin C helps maintain zinc in a bioavailable state. So as a result, that can lead to more testosterone. High copper, or at least adequate, can increase aromatase activity. Later, I'll tell you why that's a good thing. So with more aromatase, that means that there is less testosterone. With lower testosterone, there is more estrogen. And the reason estrogen might be good for you is because it can influence the magnesium transporter activity, as magnesium transporters often respond to hormonal signals. Step 2 is magnesium transporters help support PLP-dependent enzymes, which are the active form of vitamin B6. And vitamin B6 is crucial for amino acid metabolism and neurotransmitter synthesis. PLP, including choline, interact to support methylation pathways, which is needed for VLDL formation and mitochondrial function. So if you have a good mitochondria, then you'll have a better immune cells, because immune cells need a healthy mitochondria to work. The problem with choline, which is in eggs, is a TMAO. Basically, that's in short for cardiovascular risk. But there's a way to counteract that with oranges. So oranges help reduce TMAO, the compounds in oranges, and TMAO is a result of choline from eggs. So reducing TMAO lowers cardiovascular risks. So this means that choline still plays its role in mitochondrial iron transport via mitoferrin. Because if choline is not there for mitoferrin to work, then that means that vitamin A won't work because iron is not working. If vitamin A doesn't work, then intrinsic factor for vitamin B12 won't work, because vitamin B12 needs intrinsic factor to work. So that's why it's important to keep choline in your diet, but still reduce the TMAO cardiovascular risk with oranges. Step 4 is the immune and biofilm modulation. This is through cysteine thiol residues. Basically, it degrades the bacterial biofilms. And the way to do that is to bromelain. Bromelain from pineapples cleaves off CD44 and CD62L, which improves the immune cell migration into tumor environments. Or in other words, it opens up the portal, the gateway where the cancer cells are located, so that the immune cells can go in to attack the cancer cells. So step 5 is zinc, chromatin, and cytotoxic cells. So it lowers zinc from aromatase-induced changes caused by higher copper lowering zinc, which means that there's more aromatase. This actually means that the chromatin can open, because if zinc is too high because of copper imbalance or not enough copper, then the chromatin can't open because zinc closes chromatin. So yeah, that's why you should avoid excessive zinc. Excessive zinc can be a bad thing. Also avoid oysters. Oysters are very, very high in zinc. So some people tout oysters as a good thing to take. I don't really agree with that. So yeah, avoid oysters to keep your chromatin opened. If chromatin is opened, this means easier transcription of genes like granzyme B and perforins, which are like weapons that immune cells use. The perforin attaches to the cancer cell, and then the immune cell injects granzyme B through the perforin into the cancer cell, which means that the cancer cell goes through apoptosis. So the recap is the overall cascade is micronutrient deficiencies or imbalances, such as vitamin C, zinc, and copper, leads to hormonal shifts, which means lower testosterone, and then higher estrogen as a result of lower testosterone. Because with higher estrogen, some people might think that estrogen is bad, but according to my research, it can be a good thing, because higher estrogen helps magnesium. Magnesium, because magnesium, more estrogen helps the magnesium transporter. If that's working, then magnesium will work for vitamin B6 to work. Or was it magnesium needs vitamin B6? Or it could be both ways. But yeah, they both need each other. This leads to choline from eggs, which can actually raise TMAO, but that doesn't mean to not eat eggs. You should still have eggs, because TMAO is actually a cardiovascular risk marker, but that can be reduced with oranges. But there could be other foods that could do that, but yeah, oranges is a good way to reduce TMAO. Oranges are also cheap. You can also easily find them. You don't have to spend huge amounts of money on supplements just to lower your TMAO when you can just take oranges, so it's cost effective. So yeah, oranges to lower TMAO, because if you're lowering your TMAO, then you can still have your choline from eggs. Because if you don't have choline from eggs, then the mitoferrin, which is an iron transporter for the mitochondria, won't work. So if you're avoiding choline to avoid the TMAO cardiovascular risk, which is why it's important to have oranges, then you're also going to lead yourself to a vitamin B12 deficiency, which can lead to all kinds of problems. That's why it's important to keep choline in your diet, but also keep the oranges to lower the TMAO that choline raises. So choline is kept. You keep choline. That increases the